Overall, at PPTI, we are striving to provide cutting-edge research for chronic pain management. As far as our research department goes, we've primarily focused on medical devices, and there is some pharmacological studies that we pursue, but in general, we're an interventional pain practice, so we're trying to make sure we're on the cutting edge for new procedures that are coming into pain management so that our patients can get the latest and greatest.
So typically with the research studies that we currently have enrolling, if we have a patient that we feel like fits the criteria, so each study will have a specific criteria that a patient has to meet in order to be approached about their interest in the study. So typically they'll be approached by either Dr. Danko or myself, or maybe another provider to see if they have any interest in participating. And if so, then we'll provide them more information and they'll provide a voluntary informed consent.
So there's a broad term called neuromodulation, and that is basically a term that refers to spinal cord stimulators, peripheral nerve stimulators, something called an intrathecal pain pump, and other therapies that kind of leverage technology with to deliver therapies through a medical device. And so a large focus of our research program has been on being on the cutting edge for these new medical devices and offering those for therapy. As far as other aspects of research, we are involved in minimally invasive spine procedures, so procedures for low back pain. For instance, we're part of one of the first study that's going to have level 1 data for a spine procedure that involves both pain management specialists and spine surgeons, which is really cool. So I would say medical devices for chronic pain and treatments for low back pain are probably our two primary focuses, but we're always evaluating new and exciting options to bring into practice.
In my experience in working in clinical trials is just giving patients the opportunity to contribute to medical knowledge. That's something, so the studies that we currently have here at PPTI, we might be one of 100 centers globally that's participating in that particular study. So it's really a niche and something that we're really proud to be able to offer our patients here.
Being able to participate in clinical research does allow patients to be exposed to treatment options that they may not otherwise have. And then also, they're contributing to our community as a whole having access to these therapies. So I think there's an altruistic component to it where you are helping to make these therapies more widely available for other people by sharing your experiences and how you respond to the therapy. In some cases, you're getting the ability to have a treatment option that may not otherwise be commercially available by your insurance. And then, some studies do have reimbursement components, and I don't think that should be taboo to talk about. Everybody's time is valuable, and so in a given research study, there may be some ways to reimburse you for your time, because your time as a patient is just as valuable as our time as a provider.
So the studies we typically have, the studies we have currently rolling at this moment are about 2 years in length. But it can vary just based on the study and what they're looking at. So a lot of the studies that we have currently, they're looking at approved treatments, interventions, devices that are already approved, but they're really just looking to add that longevity data, add a couple years of data behind it. So a patient's consent is voluntary, and they can drop out at any point in time. So we can't bind them or hold them to it. So anytime they want to withdraw consent, they are able to do that.
Being at the forefront of chronic pain, I think, is really about initiative and always keeping an eye out for opportunities. So if we were kind of rest on our laurels and just do the same things we've always done, it's not really going to get you exposure to new treatment options. So I'm always looking and paying attention to what is new in pain management, and also engaging with industry so that I'm aware of what's coming down the pipeline. And so by being on the cutting edge and being able to clinically offer the most advanced treatments, that all often leads to research opportunities for those treatments. So A well-established treatment that's already has a stranglehold on the market, or is very commonly used, is not getting studied generally. So if you can pay attention to what's coming, then that also kind of follows on the research side.